According to the CDC, the prevalence of ASD in the U.S. is estimated to be 1 in 31 children. That's 3.2%. The rate is higher in boys. Maybe you can address that at some point, 1 in 42, whereas girls are 1 in 189. The median age of diagnosis, I know you said that you want to make an addendum to that, is 4 to 5 in the U.S. today. And there's been a dramatic, precipitous increase in recent years with a rise of 175% of the diagnosis of autism between 2011 and 2022. What is going on?
Diagnosis being 4 to 5 years old, that's the average age, certainly. But a reliable diagnosis can be made at 18 months. So there's a huge gap and a large amount of time where symptoms are not improving, they're getting worse. So that waiting is not a very good strategy.
So the average diagnosis by a quality practitioner is 18, which begs the question, what's a quality diagnosis? What are you utilizing to diagnose ASD?
So right now there is not any medical test. So there's no blood test, there's no urine test, no MRI, there's no medical test that can be done to diagnose autism. And that's where a lot of this complexity comes from. So you usually have to put together observations from a speech therapist, an occupational therapist, physical therapist, educator, and then you go in front of a specialist, usually a developmental pediatrician, and they pretty much observe your child and then give the diagnosis based upon observation. So it is very gray. It can be very frustrating to parents having to put together all these different observations. Technology is trying to be used more and more, so using AI and looking at eye gazes and things like that. But still the majority of diagnoses are made based upon this human observation and an accumulation of them.